Good afternoon and welcome to Lurie Children's. I'm Dr. Matthew Davis, the chair of the Department of Pediatrics here at Lurie Children's. I also have the pleasure of serving on the Chicago Board of Health. It's my pleasure and privilege to bring together a group of experts who are going to share with us today the latest information about COVID-19 vaccination. We're here today to talk about COVID-19 vaccination because, unfortunately, COVID-19 is again on the rise here in the city of Chicago and across the United States, in fact, around the world. COVID-19 is a preventable disease, and today, this time of year, marks a 2-year anniversary that we have had vaccines available to protect individuals from COVID-19. That's significant because here in Illinois and across the United States, COVID-19 has been such a severe illness that has led to the deaths of hundreds of thousands of Americans and has become our third leading cause of death here in Illinois. We're concerned here at Lurie Children's about COVID-19 because children can become ill with COVID-19, and also COVID-19 has taken the lives of too many parents and grandparents and aunts and uncles for children here in our city. The good news is we have COVID-19 vaccine available in an updated form, and we're going to hear today from our experts about the availability of that vaccine for all Chicagoans. I'm going to turn it over now to our guest, Dr. Allison Arwady, the Commissioner of the Chicago Department of Public Health. Dr. Arwady.
Thank you, Dr. Davis, and thank you to Lurie for having us here today. So 2 years ago today, we gave the first COVID vaccines in the city of Chicago. And boy, I didn't think we'd still be at this 2 years later. But here we are, and one of the reasons we're at Lurie is because last week, the federal government gave the authorization for the youngest Chicagoans to be able to receive the updated COVID-19 vaccine. So until now, all Chicagoans over the age of 5 were able to take advantage of the fall 2022 updated COVID vaccine. It's safe, it's effective, it's designed to help fight off Omicron. And last week, with the authorization from the FDA and CDC, the third dose for children ages 6 months to 4 years can be with that updated vaccine. There's a Moderna version, there's a Pfizer version, and again, the third dose for your youngest children should be that updated COVID booster. We've come a really long way in 2 years, and as you heard from Dr. Davis, we are on the increase again from COVID-19. We're seeing about 600 Chicagoans a day being diagnosed with COVID-19 in formal settings, meaning in doctor's offices, in pharmacies, at laboratories. We're seeing hundreds, probably thousands more, being diagnosed each day through at-home tests, which remain widely available. If you do not have at-home COVID tests, please get some now. You can go to covidtest.gov. The federal government is once again sending 4 free tests to every household in the United States that requests it, so go ahead and order those. Anybody with health insurance, your health insurance must cover 8 at-home COVID tests every month. So you can buy them online, you can buy them at the pharmacy and get reimbursed. They are also covered through Medicare, widely available at many other sites. So please make sure you have at-home tests as we are heading in to an increased surge. You've heard us talk a lot about vaccine, and let me just give you one statistic that highlights how important these vaccines have been. When we go back to the very earliest days of COVID here in Chicago, there were more than 50 Chicagoans dying every day from COVID-19. And I think at this time of year, it's important to reflect on the fact we've had almost 8,000 Chicago residents lose their life from COVID. But once we got a vaccine 2 years ago, we had the most important tool to protect against hospitalizations and to protect against death. Just since Omicron has been the predominant variant here in Chicago, I can tell you, unvaccinated Chicagoans are twice as likely to get COVID-19 than those who are up to date with their vaccines and their boosters. Unvaccinated Chicagoans are 3 times more likely to be hospitalized than those who are up to date with vaccines and boosters, and unvaccinated Chicagoans are 5 times more likely to die, actually 5.4 times more likely to die than those who are up to date with their vaccines. I am incredibly thankful that we have safe, effective, free, and widely available vaccines now for all ages. I want to highlight that if you are a family with our youngest Chicagoans, 6 months to 4 years, you should definitely reach out to your pediatrician's office. We'll hear a little more about those details. But also, if you previously received, if your child received a vaccine with CDPH, please know that as of Saturday, we will also have those updated vaccines available for the little ones, which means starting Saturday, you can come to our Free for Everybody clinic that is being held at Daly College this weekend. Everybody age 6 months and up, you can get whatever COVID vaccine you need. You can get your flu vaccine at the same time. We also are incorporating it into our at-home program. So you can call 312-746-4835, and we will bring vaccine free of charge to your home, no matter where you live in Chicago. We'll get everybody in the family up to date with your COVID vaccines, and as long as at least one person is getting a COVID vaccine, we can also bring everybody up to date with flu vaccines. So this is something that's been really good for folks who are working during the week or concerned about co-pays with flu vaccines, etc. Encourage you to use our at-home. I'm so glad that when we look at our numbers today, less than 1 Chicagoan on average is dying from COVID. But even those deaths are largely preventable. 44 Chicagoans every day are being hospitalized with COVID, and that is on the way up. We remain at a medium COVID level for Chicago and for Cook County. CDC counts every county as low, medium, or high for COVID levels. But last week, we saw New York City move into a high level. We saw Los Angeles move into a high level. We saw a number of other cities, and especially some southern states, moving into that high level. And I fully expect that as we continue to gather for the holidays and head into the respiratory virus season, I expect that we also are likely to get to a high level. What does that mean? Masks become more and more important. Wearing a mask in an indoor setting helps to protect you. It helps to protect everybody around you. And I know we've gotten out of practice a little bit with wearing the masks as we've been in a better place. I want you to know that if and when Chicago hits a high COVID level, we will be issuing a formal advisory for Chicagoans to wear their masks indoors. You don't need to wait for an advisory, though, when there are a lot of respiratory viruses going around right now. So even if it's not COVID, if you've got one of these coughs or colds going around, please put a mask on. It helps to protect others. And we will obviously keep you posted. We're watching hospital capacity very closely. But you coming up to date with your COVID vaccine, now for all ages, is the most important thing you could do. Less than 20% of Chicagoans under the age of 5 have had their booster this fall. That's not enough. So please, if you're hearing this today, celebrate the 2-year anniversary with us. Get your booster before the holiday gatherings, and know that now everybody 6 months and up is able to take advantage of safe, effective, and free vaccines. And with that, I'll bring up Dr. Kosiolek. He's a pediatric infectious disease specialist here at Lurie, and he leads the infection control work. He's going to talk a little more about the details.
Good afternoon. Thanks for joining us. So I'm really excited about this 2-year anniversary. Looking back in my efforts, being one of the leaders of the COVID-19 response here at Lurie Children's, 2 years ago it was a big day for us. I remember walking down the hall on our 11th floor, and it was the first time after a long several-month period where I was filled with relief and filled with hope. And I saw smiles that I hadn't seen in a while. I saw healthcare workers feeling comfortable, safe, confident that they can keep their family members safe. And so we're thrilled that we have this tool to be able to move forward and to continue moving closer to returning our lives to normal. So a lot's happened in the last 2 years. Where are we now? So we've had several formulations of the vaccine that have been thoroughly tested through clinical trials and through real-world experience, through distribution throughout the world. Those testing data and those clinical trial data have been vetted extensively by vaccine safety experts, by clinicians, by people that are trying to poke holes anywhere they can to try to find any signal of safety that we need to be concerned about. And we know that we can be very, very confident with the safety of these vaccines in all populations. That work has allowed us in the U.S. alone to prevent 18 million additional hospitalizations and 3 million additional deaths from COVID-19. That's profound how impactful these vaccines have been. Through that rigorous process, we found that the vaccines are not only safe in adults, but they're safe in children 6 months of age and up. They're safe in adolescents. They're safe in pregnant women. So we have a tool to protect everyone in our communities. Now, of course, new challenges are presented. Protection from vaccine, as we know now, does not last forever. We wish it did. To counter this, we keep going back and finding a new booster schedule to find out the optimal schedule with which we can keep people's immunity up to date. We know now that the virus can mutate over time. We have new variants that continue to rise. Omicron is the predominant variant, but even cousins of Omicron continue to arise. And now this new fall 22 bivalent booster is able to counteract these new variants and keep us safe and healthy as we move forward. So why should we continue to get boosters? That's a common question. A lot of people ask. We've stayed up to date. We've gotten our vaccines. Why do we have to continue to do this? Well, our bodies need to be continued to be primed against these new variants. And if we are safe and healthy and protected, we can do the things that we love to do. Vaccines are going to prevent many infections. They're going to allow us to do the things we love to do, especially this time of the year. Gatherings with family and friends. For children in particular, we know that it's essential that children remain in the classroom, that they have access to the services in their communities and their schools, that they're able to participate in the sports and activities and the things that they love to do. And vaccines are going to prevent infections and allow us to do that. We also know by preventing infections, we're going to keep those around us safe, and that's particularly important for those who are at high risk for complications from COVID-19, including the elderly and those with immune compromise. And so Dr. Arwady discussed how vaccines can be given in the community. Here at Lurie Children's, we will continue to offer vaccines to our patients in our outpatient clinics and patients who are in the hospital as well who are eligible for vaccine. We will be starting a COVID-19 vaccine clinic, or reinitiating that clinic, I should say, this weekend. And we'll be sharing information on our social media channels and with media about how to schedule if you're not an existing patient. A lot of parents will continue to have concerns about the vaccine, the discomfort that it can cause children. And for that reason, we want to invite here one of our fabulous Lurie Children's child life specialists, Leah Holscher, to provide tips about easing the vaccination process in children.
Thank you so much. I'm Leah. I'm one of the child life specialists here at Lurie, and my job is to help patients and their caregivers through medical encounters and treatments, including things like vaccines. We know that it's important to get vaccines, as we've all just talked about, to keep our bodies healthy, to keep our community safe. And we also know that it is often a source of fear or anxiety for many children and their caregivers. That's okay. We have some tips to help you as caregivers get your children through the vaccines that they need. And one of these tips is to start focusing on the why. All of these things that we've just talked about, it's important to keep our bodies healthy, it's important to keep our community safe, and focus on the things that vaccines help us do that kids love, like going to school, seeing family, and hanging out with friends. Talk to your young children on the day that they're scheduled to get the vaccine about this why, and you can talk to your older children about the why a few days leading up to the day of their vaccine. You can then make a plan with them and offer them as many choices as you can. We know that anxiety often stems from a sense of a loss of control, and we know that choices increase a children's sense of control. Choices around a vaccine can include where they want to sit, whether that is by themselves, on a caregiver's lap, on a sibling's lap, or aunt or uncle's lap. If they want to look at the vaccine as they're getting it, or if they want to look away, they can look at something fun. They can bring their favorite book, pull up a favorite video they want to watch. They can look out the window, look at a caregiver, anything they want to look at. It's also okay if they want to watch. They can choose whether they want to have the nurse count to 3 out loud before they give the vaccine, or if they want to hear nothing. They can choose if they want to hold something special or engage in an activity while they're getting the vaccine. That something special could be a favorite stuffed animal, a lovey, a sibling's hand, a caregiver's hand, or a stress ball. And they can communicate with you to make a plan about what language they will hear to know that they are absolutely done with the vaccine so that their fight or flight response can go down. You can also discuss with your pediatrician or whatever location you're getting the vaccine at if there is any pain management offerings for your child. If your child does choose to sit on your lap, you can provide a comforting hold that does 2 things. Both helps to keep your child feeling safe and helps their body hold still so they can safely get the vaccine. There are tips for comfort positions and comfort holding on the Lurie website under the vaccine page. If your child asks about pain or worries about pain before coming to the vaccine, that's okay, totally appropriate. Be honest with them. Share that vaccines feel different to every body, and you want to hear how it felt for their body when it's all done. It can help to share that some kids say it feels like a pinch, some kids say it feels like pressure. I want to hear how it felt for you. Let them know that it's okay to be nervous or scared of feeling pain or getting a vaccine, and remind them that you just made a plan to help them get through it. It is your job as a parent to help keep their body stay safe, and sometimes that includes doing scary or hard things like getting vaccines. When the vaccine is done, be sure to provide your child with ample verbal praise and let them know how proud you are of the fact that they just did something scary. This can sound like, I know that you were feeling scared about that. I'm so proud of the choices you made, and I see that you worked really hard to hold your body still. I'm now going to hand it over to Dr. Luna from CDPH.
Thank you. I will be giving the remarks in Spanish for this section. Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y hoy les traigo las últimas actualizaciones. Hoy marca el 2º aniversario de las primeras vacunas de COVID-19 administradas en Chicago. Desde el 15 de diciembre del 2020 se han administrado más de 5.6 millones de vacunas y más de 2 millones de personas han recibido al menos una dosis de la vacuna. Este es un hito tremendo que nunca hubiéramos podido alcanzar sin el apoyo y la colaboración de tantos proveedores y líderes en Chicago. Gracias. También quiero agradecer a todos los habitantes de Chicago, desde nuestros más pequeños de 6 meses hasta nuestros adultos mayores, que dieron un gran paso al frente y se vacunaron. El COVID-19 ha sido un reto para la ciudad. Lamentablemente, casi 8,000 habitantes de Chicago han perdido la vida a causa de la pandemia. Pero sin las vacunas habríamos perdido miles de vidas más. Debido a que tenemos vacunas seguras y efectivas, nuestros hospitales todavía no están abrumados con pacientes de COVID-19. Nuestras escuelas están abiertas, los negocios están abiertos y las familias pueden reunirse de manera segura en estas festividades. La semana pasada, los funcionarios federales de la salud aprobaron las vacunas actualizadas bivalentes que se enfocan en proteger contra las nuevas subvariantes de Omicron para niños de 6 meses en adelante. Insto a los padres a que vacunen a sus niños. Esta es una nueva vacuna que ayudará a proteger las familias de los peores resultados de COVID-19. Esta vacuna es para todos los miembros de la familia, desde niños hasta mayores. Tome la decisión de vacunarse antes de las vacaciones de los días festivos para proteger a su familia y a su comunidad. Las vacunas siguen siendo completamente gratuitas para todos y están ampliamente disponibles en farmacias clínicas de salud. También te llevamos la vacuna a tu casa a través de nuestro programa Protege a Chicago al Hogar y vacunamos hasta 10 personas por vez. Solo tienes que llamar al 312-746-4835 para hacer una cita. Así que, Chicago, felicidades y cuídense. I hand it over back to Dr. Arwady.
Okay, we're happy to take any questions, any of us, if you have any. Yes, I'll start, and then I'll actually ask my colleagues from Lurie to chime in, because they've been seeing a lot of that here. So yes, we have seen an increase in COVID, which is continuing. We have seen a very early flu season starting. We've seen more people getting flu and hospitalized with flu at this point in the year than we've seen in many years. And then RSV, or respiratory syncytial virus, is a virus that can really be a problem, especially for the littlest children. And we saw very record-breaking high numbers of that. And in places like Lurie, you know, lots of problems with almost running out of hospital beds. The RSV numbers, thankfully, are on the way back down, but they're still quite high. And besides RSV, influenza, and COVID, there are a lot of other respiratory viruses that are making people sick right now, giving people colds. We've had a couple of years where COVID has been so strong that these other viruses have not really had the opportunity to spread as much. We've also been masking and distancing and some of these other things. And so these all spread in similar ways, and when we think of sort of the winter season, we think of that as the respiratory virus season. So what I would say is that the good news is that a mask is not just helpful for COVID. It's helpful for influenza. It's helpful for all of these other viruses. Basics like hand washing, staying home when you're sick, especially if a child or an adult has a fever, and then, you know, seeking care as needed from a pediatrician or an adult doctor. For both influenza and COVID-19, there are also medications available. If there are people who are at higher risk of severe outcomes. So for either flu or COVID, people over 50, people with underlying conditions, there's medications, if you do get infected, that can help keep you out of the hospital, but you have to start them in the first few days of symptoms. So it's important, you know, as we're thinking about all three of these and even more viruses, that we're vaxing against what we can, flu and COVID predominantly, plus the routine childhood vaccines, and then Pax, which is Paxlovid. That's the medication, again, for people who have underlying conditions if they do get COVID. And then there's a similar medication available for flu at high risk. So all of these run together. We're watching hospital capacity really closely. It's the thing I'm the most worried about, just as we look ahead. And I would invite either of my colleagues from Lurie to talk a little bit more about what you're seeing.
It's a really great question, and I appreciate you bringing it up because I think as we talk about viruses, we tend to focus on one. And in reality, there are a lot of threats that occur throughout the year, and especially in the wintertime. One of the nice things about getting out of the largest surges of COVID and into a more sort of normal world again is that all of the things that have been normal for pediatricians in years past are coming back. And a lot of children haven't been exposed to things like RSV and flu, and so there's a whole lot of children that haven't developed immunity to those. And vaccine uptake related to flu vaccine declined during the COVID-19 pandemic the first 2 years. And so what we're seeing right now is quite a bit of influenza. We're seeing more influenza right now than we did at any point of COVID-19, even during the Omicron surge that started roughly a year ago this week. Fortunately for influenza, we have a very highly effective influenza vaccine that's particularly effective this year that can be given safely with the COVID-19 vaccine or the COVID-19 boosters. And if that's done now, that immunity would kick in by the time December 25th, the Christmas holiday, and the beginning of the new year. RSV has declined quite a bit. We're fortunate for that. However, we've seen very strange timing and seasonality of RSV for the last several years, and so we need to be prepared for second surges throughout the winter season. We were fortunate in the pediatric community that COVID, compared to adults, was not as big of a threat. That is not true for influenza. That is certainly not true for RSV, particularly in infants, and so we do need to be very, very careful in considering things other than COVID-19. Fortunately, a lot of the common sense measures that we have not only will prevent COVID-19, they'll prevent influenza, they'll prevent flu, and they'll prevent the complications from those viruses. Those viruses can serve as a risk factor for children getting even more ill with pneumonia or bloodstream infections, respiratory failure, needing the ICU. And so all of those things can be prevented with good common sense measures and with vaccination.
Thanks for that question. And anytime our communities are facing multiple different viruses that are causing a lot of illness, we always have to keep in mind how much capacity our hospitals have here in Chicago and across the state. When it comes to children, we know that over time, the number of hospitals that are taking children in when they need hospital level care is decreasing. That's true here in Illinois and Chicago. It's true across the country. And that means when we see a surge in illnesses such as RSV and influenza, we can face major challenges when it comes to having enough hospital beds available. Fortunately, hospitals here in Chicago and across the state are very cooperative and collaborative with each other in terms of trying to identify what beds are available, making certain that the kids who have the greatest need get to the hospitals who are best prepared to take care of them. Over the last week or 10 days, we have seen a decrease in RSV infections, which has reduced the pressure on hospitals somewhat. However, we are concerned about rising numbers of cases of influenza, and so along with the city, we're monitoring the availability of beds for children and for adults, especially as the numbers for COVID infections increase among adults in particular. Hospital capacity today is our best measure of our readiness as a community to take care of the most ill individuals. What we can all do together is help prevent illness through vaccinating against COVID and against influenza.
So what would be the percentage of capacity right now?
The information that we have in terms of here at Lurie Children's today is that we're at about 90% of our capacity. 2 to 3 weeks ago, we were at 99% of our capacity, or some days we were full completely, and unfortunately we had to turn down transfer requests from other hospitals. We're proud at Lurie Children's to serve as a transfer destination for over 120 different hospitals here in Illinois, and we take that responsibility very seriously. Obviously, in situations where there's so much illness in the community and we can't take those transfers, that's a concern overall in terms of the capacity of the whole system. Vaccination is even more important at those times than ever before.
Sure. All right, so Let me just first expound on what Dr. Davis said. We watch hospital capacity very, very closely. We don't just watch it for COVID. We look overall, how are we doing as a system? That is available publicly on our website every day. We update across the whole system what is hospital capacity. We also separately track what percentage of our beds are occupied with patients with a COVID diagnosis right now. So across the whole city, we're about 87% full, our hospitals right now, and that is okay. It's pretty full, but we have room to sort of grow there. But the influenza hospitalizations are on the way up, as are the COVID hospitalizations. I would say when it comes to COVID-specific numbers and about reporting, we don't count every single case of flu. We never have, and we don't need to, because we have lots of other ways to measure what is happening with influenza. We take samples from offices across and emergency departments across the city. We have some systems we track very tightly. We look at the samples that are sent into laboratories and see what percentage is positive. So there are a lot of ways to track how a disease is going without having to count every individual case. COVID was unusual because early on we were tracking every case that was diagnosed, but we were looking ahead to when there would be wider testing availability with the at-home tests. I am thrilled that we are at a point where there is wide availability of free at-home tests, because we want people to have a result right then and act on it, to stay home if they're positive, to seek care. And we do not need to follow every single case at all. When the CDC looks at metrics and sets those low, medium, and high, there's three things they look at. The first one is laboratory confirmed cases corrected for hospitalization. So most of those at this point are people sick enough to come in to see a healthcare provider, getting tested somewhere like Lurie's, getting tested in a lab. And that continues to track, in a good way. The second number that we look at is how many people are being hospitalized with COVID per 100,000 population. And the third is that number I mentioned first, which is what percentage of your hospital beds are taken up with COVID. We're at 4.7%. About 5% of our beds across the city are taken up with COVID right now. We have a high level of concern if that about doubles. If about 10% of our beds across the city are taken up with COVID patients, we start to get into a situation where it becomes hard for hospitals to take care of everything else, especially if there's a flu surge on top of it. I mean, things like, somebody has a car accident, somebody has a heart attack. And so those are the numbers we're watching, and those capacity numbers in particular are the ones we watch if, I hope we never have to do, formal orders. I'm not anticipating shutdowns, anything like that, to be clear. But things like mask requirements indoors, those track along for us with if we really start to see our hospital capacity get stretched. And that remains my biggest concern because that is a really finite resource. And we have seen 3 times during COVID, the very beginning, sort of December of that first winter, and then the Omicron surge last January, 3 times, we have really seen our hospitals get almost to that breaking point, and it is our job to make sure that that doesn't happen. So getting those vaccines for flu and for COVID, if you've not had a vaccine since Labor Day, you're not up to date, basically. That helps protect our hospitals, and that's the number one thing I'm concerned about. Yes. Yeah, it's a really good question. The question was, why do people who are not older or don't have underlying conditions, why is it important for them to get vaccines? So I'll start actually with the individual level. That at an individual level, COVID remains somewhat unpredictable. And when I think about particularly the risk of long COVID, we have millions of people at this point who, not all of whom were fully predictable, that are continuing to have problems, in some cases a long time after having had COVID. And that's different than a lot of other viruses we've had in the past. So just at an individual level, even somebody who is young and healthy, you don't want to just get COVID and not worry about it, because there is the risk that, you know, even young healthy people sometimes end up in the hospital, end up seriously ill, but also there is still this risk of long COVID for which we don't have good treatments. So on the individual level, that's why. But the bigger reason is because getting a vaccine is not just for you, it is for your community. And when you are protecting yourself, you know, you heard me say right here in Chicago, people who are up to date with their vaccines are about half as likely to even be infected from COVID. And when we think about people who are young and healthy, they often are interacting with people who are older, with people who are at higher risk. And getting vaccinated, you know, I think is part of sort of the social contract of taking care of each other. We've talked a lot about vaccines these last few years, and I've had some young healthy people say to me, you know, I never used to get a flu vaccine because I wasn't that worried about it for me, but now I know that when I get my flu vaccine, I am also helping to protect the community and helping to protect things like hospital capacity. So both on the individual level and on that community level and caring for others, it really is something that we ask and urge people to do, because it prevents. Vaccine is about preventing disease, and preventing disease is both an individual and a social good. Yep. All right. All right, well, thank you very much for coming. Appreciate it.